Today, we're diving into a big myth in pregnancy wellness that the solution to every pelvic floor concern is to just do more Kegels. Spoiler alert, that is not the whole story. Now, how many of you have been told by your gynecologist to do Kegels if you have pelvic floor concerns? I know that was the first advice that I was given way back in high school when I was struggling with leakage during cross country races. Fast forward into pregnancy and postpartum, and what is still the most commonly referenced exercise in any medical office for women's health, and it is Kegels. Now, why this matters is that so many women enter pregnancy and postpartum thinking that Kegels are the golden ticket. Today, I will explain what the pelvic floor actually does, why coordination and relaxation of your pelvic floor muscles matter way more than clenching and strengthening. We'll also discuss how to train your pelvic floor smarter and not with Kegels. Let's dive into the role of the pelvic floor. Simply put, these are muscles at the base of your pelvis, and there are three layers to them. I like to think of these muscles laying like a hammock at the base of your pelvis. They support your bladder, your bowel, your uterus, really all of those internal abdominal organs and reproductive organs that sit in our abdominal cavity. Your pelvic floor is at the base of that pelvis, and that is a very supportive outlet to keep all of those internal abdominal organs inside of our body. These muscles contract, relax, and stretch. Those are their three key jobs. Now, keep in mind that's the same for pretty much any muscle in our body, right? We want our biceps muscle to contract, to relax, and be able to stretch and lengthen. The same is true for our pelvic floor muscles. These muscles also help with continence and are the muscles that we can blame whenever we notice incontinence, when we're unable to control our bladder or bowel function. Our pelvic floor muscles are integral for sexual function. And again, whenever we see issues here, we see a sexual dysfunction. We see issues with pain or inability to feel intercourse the way that we ideally should. And most importantly, in pregnancy, our pelvic floor muscles are an area that our babies have to move through in order to exit during a vaginal birth. So the pelvic floor is a very important part of birth prep. Yet it is often ignored. Any woman moving through the traditional medical system is not often recommended to do pelvic floor physical therapy as part of their birth prep. And it should be. Every single pregnant woman should be seeking out a pelvic floor physical therapist. And you may say I'm biased because I do pelvic floor physical therapy, but truly think of the way your child is coming into this world. If your goal is a vaginal delivery, we need to work on the pelvic floor muscles, and I can guarantee you Kegels is not the answer. So to put it all together in terms of thinking about these pelvic floor muscles at the basin or at the bowl of that pelvis, I want you to think of those pelvic floor muscles like a trampoline, not a rigid board. These muscles need both spring and rebounding, as well as that give or descent. So just like if you're jumping on a trampoline, you get that give, that descent of the trampoline, but then it springs back up, it recoils, it rebounds you. We want the same for our pelvic floor. Now, here's a quick history lesson for you to break down the history of Kegels. So the Kegel exercise was first introduced in the late 1940s by Dr. Arnold Kegel, a gynecologist. He originally designed it as a way to help women improve bladder control and pelvic muscle tone without surgery. His idea was simple. If women could strengthen the muscles that support the bladder and uterus, they could prevent leakage and improve sexual function. Sounds pretty great, right? At the time, it was revolutionary because before that, there weren't many non-surgical options offered to women for these concerns. But here's the thing. Dr. Kegel's work focused mostly on contraction and strengthening. What we've learned since then, since the 1940s, people, is that the pelvic floor isn't just about being tight or strong. It also needs to relax, coordinate with breath, and lengthen, especially during pregnancy and birth. This is why Kegels are a part of the history of pelvic health, but they're certainly not the whole story. And that's why we now teach a much more complete and functional approach to training the pelvic floor. Now, something I've heard from, generations before us, who have been through motherhood in the past, I've heard it expressed that pelvic floor health is, quote, a trend. And I want to debunk that, because if we think about going back to the 1940s when the Kegel exercise was introduced, we have seen a skyrocketing rate of incontinence. And so I've had women express to me, well, my grandma never needed pelvic floor physical therapy. Like, why do I need it now? Did our grandmas struggle with incontinence, but they just never talked about it? Well, they certainly did. I mean, that's why Dr. Kegel developed the Kegel exercise, because incontinence, leakage, pelvic floor symptoms were a concern. And at the time, they were only being treated surgically. So at the time, it was revolutionary. However, I would like to think that this has contributed to a rise in incontinence in young women. And we are seeing incontinence in female athletes like skyrocketing. We have seen incontinence during pregnancy and in postpartum women. And understanding that Kegels can actually make things worse is really important, because most gynecologists are only prescribing Kegels. They don't have the training to educate you on how to coordinate, relax, connect with those muscles outside of solely tightening and strengthening. So again, Kegels are just responsible for tightening or strengthening that pelvic floor. What our pelvic floor really needs to learn to do is to be reactive, like a trampoline, where we get that rebound and that descent. So in summary, with the Kegel myth, it is incomplete. Not every woman needs more tightening. Over recruitment of the pelvic floor muscles leads to more tension, more pain, increased leakage, and difficulty in labor, which we are going to talk about in regards to pregnancy specifically. If you only ever squeeze or tighten the pelvic floor, you miss 50% of the muscle's job, which is letting go. Common signs that Kegels aren't enough would be pain with intercourse, constipation, or incomplete bowel movements. So you have to have a bowel movement, but you're unable to get all of it out. A feeling of pelvic heaviness despite doing all of the Kegels. Like, you are doing your Kegels like it is your job, but that sensation of pelvic heaviness isn't going away. Kegels are not your answer. If you are struggling to relax during pelvic exams, or pelvic exams are painful during that yearly woman's exam, stop doing Kegels. That's not the answer. All right. And then finally, with birth prep. So, women who have a difficulty with labor stalling out, or a baby gets, quote, stuck in their pelvis, or they have huge tears during delivery, that is a sign that your pelvic floor is tight, and we need to work on relaxation of those muscles. All right, so we are connecting the pelvic floor to birth now. And during labor and delivery, the pelvic floor's main job is to get out of the way. AKA, those muscles need to lengthen and relax so that our baby can descend into our pelvis and out through our birth canal. Without this ability, pushing can be lengthened, more difficult, and lead to more interventions. Okay. If we have a longer pushing phase of labor, this can be challenging for baby. We can see heart rate decelerations. It's also very hard on mom, right? Childbirth is a marathon, usually not a sprint. And that pushing phase of labor, when it is extended, can be very trying on the mother and on the baby. And so learning how to relax the pelvic floor muscles ahead of time is huge for shortening labor overall, but then also shortening that pushing phase of labor. It also leads to less interventions. And so if a woman is unable to relax her pelvic floor, sometimes she will be proposed to get an epidural, because she just needs to be able to let go. And she's tight. She is really, on edge for each next contraction, versus being able to let go and let the surge move through her body. And so sometimes an epidural can be the answer that is utilized to help the pelvic floor relax. Sometimes an episiotomy is utilized if those muscles are not relaxing and we need to get baby out right away. Because of heart rate decelerations, an OB may elect to perform an episiotomy, which is a cutting of the pelvic floor muscles. Now, anytime that is recommended, of course, baby safety is top priority, as is mom's, but Ideally, we want to avoid episiotomies at all costs because any natural tear is better than a cut, because episiotomies are often going to be much larger than if you were to simply tear naturally on your own. We also know that interventions that can be led to are the use of forceps or suctions to help get baby out, or use of your provider's hands. And so again, like, it is so important to learn how to relax your pelvic floor ahead of labor and delivery if you are currently pregnant. Now, during pregnancy, we do need strength. We do need strength in that pelvic floor to support our pelvis. We have the constant load of growing baby. And if our pelvic floor isn't strong, we might notice things like leakage. We may notice things like prolapse. We may have back pain, SI joint pain. So yes, we do need strength of the pelvic floor, but it's about learning this coordination of both the strength and the letting go, so that when it comes to birth, we're able to relax and let the pelvic floor truly get out of the way. So how do we train the pelvic floor smarter? And we let go of this idea that Kegels is the answer. So I'm going to break it down into 3 pillars. Number 1 is coordination. We need to learn the ability to both contract and relax the pelvic floor muscles. All right. So the example that I like to use is our breath. So we want to inhale and relax the pelvic floor muscles. This can be done in sitting, it can be done standing, laying down. So whatever position you're in right now, I want you to make sure your legs are uncrossed, your feet are equidistant apart. We have equal weight through both legs. We're not shifting over to one side versus the other. And you're going to inhale through your nose, feeling that breath travel into belly, side ribs, low back, and all the way into that pelvic bowl. And I want you to feel the letting go of those pelvic floor muscles, those muscles between your sit bones. Almost feel a spreading of your sit bones, a lifting of your tailbone. And then on the exhale, you're just going to simply feel a rebound, a recoil. Think of that trampoline, right? Where it rebounds back up as that breath moves up and out. And you will repeat. That is beginning to get your brain to muscle connection with the pelvic floor to understand both the contraction and the relaxation. This is entirely different than Kegels because we are in no way actively contracting the pelvic floor right now. Instead, we're using that trampoline analogy and we're inhale, getting the descent, exhale, getting that recoil, that natural spring. So that's step 1. Step 2 would be integrating breath work with movement. And so now we're getting an active contraction of the pelvic floor on an exhale. So pairing your breath with a movement such as a squat. We want to inhale down into your squat. Our diaphragm lowers, all of those internal abdominal contents move down into that pelvic bowl. Our pelvic floor naturally lengthens. On your exhale, we're going to act like you're lifting a marble through your vaginal opening. So you're going to gently engage that vaginal opening, lifting it up and in as you then contract your glutes and rise to stand from that squat. So this is an active form of breath work or of diaphragmatic breathing, where on our exhale, we're now getting an active contraction. Now, some could argue, isn't that a Kegel? Well, a Kegel is when we simply just contract the pelvic floor, and it has no focus or emphasis on the relaxation. So this is entirely different than a Kegel because we are pairing it with our breath, and that is training the proper mechanics for how we want that pelvic floor to automatically move fluidly throughout the day. So practice syncing your breath with your movement. So I just use squats as an example, but we want to use as a good rule of thumb, exhale on the effort. So you're going to inhale to get length into the pelvic floor and then exhale, gently engage and lift the pelvic floor, drawing that vaginal opening up and in, and then inhale, relax it back to that starting position. So start integrating your pelvic floor contract and relax with your breath during movement. And then the third pillar is strength and mobility. So yes, strength matters, but in a variety of movement patterns. So Kegels, the typical Kegel exercise is you're at rest and you're contracting the pelvic floor and you're holding it for X amount of time, or you're quickly turning it on, turning it off, turning it on, turning it off. We want functional strength, right? So we can start challenging the pelvic floor with varied movements. So if we're doing a body weight squat, that's going to look very different than if we are lifting our toddler, right? Our 40-pound toddler. Now we need more pelvic floor contraction compared to a body weight squat alone. We also want to look at mobility. So I love working the pelvic floor in a variety of positions. Think of a lunge and how that puts one leg forward, one leg back. That's going to pull on the pelvic floor differently than a squat does. A squat with our feet very widely externally rotate, if we think of like a sumo squat, that's going to open the pelvic floor muscles more and allow us to get deeper into our squat. So you get to start playing around with different challenging positions. I will also work with clients who have a goal of returning to running or plyometric training. We'll work on jumping and how to coordinate the pelvic floor with that. So coordination, breath work, and then strength and mobility, where we're challenging the pelvic floor muscles in different ways. When it comes to preparing the body for birth, we focus on strength and coordination and breath work on the front end of pregnancy, really those first and second trimesters. And then in the third trimester, we really transition to mobility, where we do want to help open the hips. We want to help open the pelvis and the pelvic floor. And so recognizing that we can have this bell curve during pregnancy of how we address these muscles to optimally assist them in strength on the front half of pregnancy, coordination, and then optimizing mobility on the back end to optimally assist with labor and delivery and reduce risk of tearing, reduce length of pushing phase during labor, all of that good stuff. So key takeaways here are that most women do not need Kegels, but all women are going to benefit from learning how to relax their pelvic floor, how to coordinate their pelvic floor with breath and movement, and then how to build functional strength, particularly in this case during pregnancy and postpartum, right? But this goes across the board for all women in all seasons of life, because we know that pelvic floor issues are not isolated to pregnancy and postpartum. Now, if you are listening to this and you're like, I just do not know if I'm accessing these muscles appropriately, seek out a pelvic floor physical therapist, either in person where you are or virtually. So I am located in Sydney, Ohio. I serve all of the surrounding areas. I have clients who are very local and come here, but I have clients who are coming from 2 hours away. So know that there is help. And I also treat clients virtually. So if there is not a pelvic floor physical therapist in your area, we absolutely can do a virtual assessment, a consult, and really work through things specific to you and your concerns. You'll be amazed at what we can accomplish in a 60-minute session together. If you are interested in working together, I will leave the information in the show notes. It's myself and then a team of PTs. So even when I'm on maternity leave, you are welcome to work with anybody on our team. We would love to help you through your pelvic floor concerns. And as I move through pregnancy myself, it is just this light bulb moment of how grateful I am to have the education and the knowledge that I have in how to prepare my body for birth, because I understand that it is just not gold standard. I mean, it is gold standard, but it's not typical to get this level of education on how to relax your pelvic floor, how to coordinate your pelvic floor. And every midwife that I have spoken to throughout my care plan reiterates how important it is and how we need to get the word out more and more, because really all women who are pregnant should have pelvic floor physical therapy before labor and delivery. It would help birth outcomes in America so very much. So I will get off my little soapbox there, but I want to reassure you that if Kegels have not worked for you, it is not because your body is broken. It is not because you are unfixable. It's simply because your pelvic floor needs a different approach, and Kegels are not the answer. Now, if you are pregnant and you want some support from the comfort of home, join my Holistically Well pregnancy program. This is where I guide you through step-by-step breath work, coordination, and strength training to prepare your body for birth. It's truly amazing, and I would love to see you inside the program. Now, if this episode just sent off light bulb moments for you, please share it with a friend, especially a friend who is pregnant and needs to understand that Kegels are not the answer, and learning how to coordinate your pelvic floor is. Drop a review for the podcast. Let me know what stood out to you most from this episode, and we'll see you next Tuesday on the Holistically Well podcast.